Hey gang, happy Saturday. So I wanted to jump on and address a common question that I get from clients that are interested in the 7-week programs I run or even kind of working one-on-one. And that is, I have diabetes, my friend has diabetes, my sister has diabetes. Can they fast? If you're catching this on the replay, my name is Amanda Nybert. I'm a registered dietitian specializing in bariatric and weight loss nutrition, and my goal is to provide you with relevant nutritional strategies and information to help you stay on track or get back on track with your weight loss. So I'm often asked by people about diabetes and fasting. And the bottom line is, if you have diabetes, yes, fasting can be a very powerful nutritional strategies to kind of get you back on track. And in order to really understand why fasting works so well with diabetics, you kind of have to understand the endocrine functions that happen in the body and how that's associated with fasting. Now, I will mention at the very end, there are a handful of people with diabetes that fasting might not be a good technique, and I'll kind of point those out towards the end. So, in order to really understand why fasting can be beneficial to diabetics, you kind of have to understand how the body works. And I think it's important to note that, in the 1970s, 60s, 1950s, we really just didn't have a good understanding of the endocrine functions in the body. And because of that, we had this basic mentality that weight loss was all about calories in versus calories out. That, if you wanted to lose weight, you had to reduce your caloric consumption in order to burn more calories. And we now know today that it's just not that simple. It's not solely about calories in versus calories out, because different calories, macros, carbohydrates, proteins, and fats affect the body in different ways. Some promote fat storage, some don't. So it's really more about the big picture, understanding what food you're eating and how those impact your body to really get the best understanding of how to lose weight. Okay, so back to diabetes. So basically, when we think about diabetics, and I work with a ton of diabetics in my clinic at the hospital, and I love working with diabetics because diabetes is a disease of diet. Simple as that. It is not progressive. It doesn't have to be chronic. It's completely curable if you get on track with the right food choices. The problem is that our medical model is all about treat, not prevent. We want to treat the symptoms. We don't want to address the underlying cause or try to prevent, diabetes. And I think that our medical system is so bogged down. Our primary care physicians are so bogged down with patients that they don't have 45 minutes to sit and talk to a diabetic and say, hey, if you change your food choices, you probably won't need this metformin. Or if you change your food choices, you probably won't need this insulin. And so until we get to, a better treatment model, this is kind of how it is. So a lot of times I'll sit down with a diabetic, and a lot of times it's eye-opening. I show them, this is why this happens in the body, and this is why your blood sugar rises. And if you do this, it prevents that. And like little light bulbs go off. So I love working with diabetic patients. So basically, when we consume food, specifically carbohydrates and sugars, that causes a rise in our blood sugar. And high levels of blood sugar is not good, okay? So our body has evolved to produce insulin. So when we eat, say, a big bowl of mac and cheese, our blood sugar rises. Then that triggers the pancreas to secrete insulin, and then that insulin decreases the blood sugar. That insulin forces the body to utilize either the blood sugar as energy right then and there, It's either stored in the muscles, it's either stored in fat cells, which happens most of the time, or it's stored in the liver as glycogen. So over time, when we eat the standard American diet, I call it the SAD diet. It's very sad, which is very high in carbohydrates. The average American consumes 400 to 500 carbs a day. It creates what we call insulin resistance. So the blood sugar rises, insulin secreted, it drops, but this constant up and down, this constant secreting of insulin, the body gets to the point where it doesn't work. So now all this insulin is being flooded into the body and it's not helping reduce your blood sugar levels. So now we're diabetic. And with insulin resistance, it makes you very tired, it makes you very hungry, it gives you brain fog, so you feel like you don't think very clearly. It causes weight gain, increases your blood pressure. So now it's like a vicious cycle, okay? So now we're eating crappy and our blood sugar's rising, our insulin's not working anymore, and so now we're even more tired and we're even more hungry. So that's where diabetes will get you. And then you just keep gaining and gaining and gaining. So your blood sugar's elevated, your doctor puts you on prescription meds, and that's supposed to help your blood sugar decrease. And it probably does. But if you don't change your diet, it eventually won't work. So now we add more. Now we're taking higher doses, we're taking double meds, we're taking triple meds. And then the very end, the last resort is we start taking insulin. And that's it's just the worst case scenario because insulin is the number one fat storing hormone in the body. So the moment that patients get put on insulin, what happens? They gain a ton of weight. It's very challenging to lose weight when you are injecting yourself with insulin multiple times a day. So when I work with a pre-surgical insulin-dependent diabetic, I tell them, hey, listen, you're not going to lose any weight. I'm going to put you on this super low-carb diet, and you're probably not going to lose any weight. Don't get on the scale because it will discourage you. The only way that I know you're doing what you need to do is your insulin levels are decreasing. And that's good because I want you using less insulin, because if I can get you using less insulin, then I can get you losing weight. So it's kind of like that vicious cycle in terms of with diabetes. So that's why fasting can be such a powerful nutritional strategies for a diabetic. Because it helps to regulate your hormone levels. It gives you a spike in your growth hormone levels. It reduces your leptin levels, which improves your hunger. So across the board, you're going to see positive results in the way you feel and the way you lose weight. So with intermittent fasting, which is what we implement in the programs that I run, we eat for 8 hours and we fast for 16 hours. And this forces the body to utilize all the energy stores in the body as much as possible. When we use that old model of 6 small meals a day, which is what they tell a diabetic to do, it creates that constant blood sugar, insulin response. In order to lose weight and regulate your blood sugar, you got to reduce the insulin in the body. So that's where the fasting is super beneficial because it forces the body to burn through all of that energy. Now we're tapping into your liver where those glycogen stores are. Then we're tapping into those fat cells where there's even more energy. So now we're breaking down fat. So diabetics see huge benefits and positive changes with their blood sugar numbers and their hemoglobin A1C, which is that kind of 3-month average of kind of what they're doing when they implement fasting. Who is the king and guru of fasting? Well, Dr. Fung out of Toronto. And he has an amazing clinic, and he has a great book if you're interested in learning a lot about fasting. It's the complete guide to fasting. This is an easy read, but he's doing incredible things with his diabetic patients. He's fasting his patients for days and weeks at a time. He's getting diabetics off insulin within 3 or 4 weeks of fasting. So we know that fasting can be a really powerful technique for diabetics. Now, I will say, whenever I'm working with a diabetic, I do like to give them a couple of different protocols or just tips to kind of make sure that they feel okay, because diabetics get really concerned about their blood sugar dropping, especially if you're on insulin, and because you don't feel good when your blood sugar drops. And diabetics tend to have these kind of swings with these high sugars and these low sugars. So I like to kind of warn a diabetic to maybe ease into the fasting. Don't start out with 16 hours right off the bat. Maybe start with 10 hours and then go to 11 or 12 and then go to 14 or 15. But usually by the 7th day, they're able to fast for 16 hours without any issue. The other thing that I like to mention, and this is really kind of for anybody, is that when you first start fasting, you do get these symptoms of kind of lightheaded, maybe a little fatigue, and they're symptoms that you associate with low blood sugar. But almost 90% of the time, it's not your blood sugar dropping, it's an imbalance in your electrolytes. So I tell pretty much all my clients for that first week or two, stock up on electrolyte enhanced water. You can't really see this, but this is actually like an alkaline, but it's also a water with electrolytes. You don't want to drink Gatorade. Gatorade's got tons of sugar in it. You can find a simple water infused with electrolytes that's going to help you balance out your electrolytes. So usually if you're feeling like that sugar's dipping, I'll tell my clients to drink a big bottle of one of these electrolyte waters and you feel better, because it really wasn't your blood sugar to begin with. It was really just kind of that imbalance with your electrolytes. So that's another big tip that I'll give my diabetic clients. The only person that would potentially have issues with fasting would definitely be a type 1 diabetic. Type 1 diabetes is completely different than type 2 diabetes. Type 1 diabetes we used to call juvenile diabetes because it was onset at childhood, but we actually don't call it that anymore, because unfortunately our children are getting type 2 diabetes at a very young age. And there's a big difference between type 2 and type 1 diabetes. So type 1 diabetics, they just don't have a functioning pancreas. They don't secrete insulin. So they have to take insulin on a daily basis. So regulating a type 1 diabetic in fasting can be a little bit more tricky, and it takes probably more medical supervision under a physician. So if you're a type 1 diabetic, meaning you're diagnosed with diabetes way when you're little, then I would suggest that you seek a medical profession to consider a fasting protocol. If you are an insulin dependent diabetic and you are taking insulin, but you are a type 2 diabetic, then you can safely fast. You just have to take really good you have to keep really good track of your blood sugar levels. You want to make sure that your sugar is not going too low. You want to make sure your sugar is not going too high. So there is a little bit of an adjustment with an insulin dependent type 2 diabetic. So there may be some transition. But let's be honest, the best thing about fasting, and people get really, they're really concerned about fasting. And I don't know, I've got a lot of clients that are watching this right now, and give me some thumbs up, but the fasting is easy. It turns out to be the thing that my clients love the most. And the best thing about fasting is that if you're not feeling great, if you're on hour 10 or 11 and you're not feeling great, just eat. Who cares? It's not a big deal. Fasting is not an all or nothing nutritional strategy. It is something that every time you fast, you receive benefits. So if you fast once a week, great, you got the benefits. If you fast every day, great, you got the benefits. But if you're a diabetic and you're implementing a fasting protocol and you're not feeling like it's going great today, then you just break your fast. All right. Ideally, you're not going to break your fast with a big bowl of macaroni and cheese. You're going to break your fast with maybe some nuts, maybe some peanut butter, or a big salad with chicken on it. Because diabetic management is all about carbohydrate control. You got to reduce the carbohydrates in your diet. And I'm not talking about a low carb diet. You don't have to eat no carbs to manage your diabetes. You can consume anywhere from around, 20 to 30 carbs per meal, 20 carbs per snack, and manage your diabetes. So it's not about like no carbs, it's about carb control. And that's usually what I try to really hound in on my clients in my clinic, is that, we don't promote a low carb diet for life, specifically after surgery. We promote a carb adequate diet for life. 400 to 500 carbs a day is not a carb adequate diet. That is carb ridiculous. Carb adequate is like 100, 200 carbs a day. You just don't need more than that. So if you're a diabetic and you're considering one of my programs, I say do it. Let me know that this is your underlying condition. I'll be happy to work with you a little bit closer one-on-one to make sure that you feel good while going through this program. But I promise you, the programs that I run are going to manage your diabetes better than anything ever has before. And I would love the opportunity to work with you. If you found this information beneficial, I promise you your friends and family would probably too. So I encourage you to use the share button below and share this out to them so that your friends and family with diabetes understand that they do not have a chronic and progressive disease, that they have the opportunity to reverse their diabetes, feel better, lose weight, and get back on track. And I would love to help them do that. I'm going to put my link in the comments section. I hope you guys have an awesome Saturday. I am off to the UK football game, hence the all blue. So hopefully you guys will have a great Saturday yourself, and maybe I'll get a chance to work with you. Thanks. Bye.